We know that the pandemic is having a dramatic impact on the psychological burden of nurses overall. And I think that one of the important things to consider is that this picture is changing as the pandemic lingers and will continue to evolve over time, even after the last COVID patient leaves the hospital. Specific to this pandemic, we know that nurses are experiencing significant depression, anxiety, burnout as it's been measured, and they're leaving our hospitals and health systems in droves. We also know that research has linked nurse fatigue with specific issues like increased mental health issues, poor patient outcomes, and decreased nursing performance at the bedside, which all of course contributes to decreased self-esteem and increased feelings of alienation from the workplace. We also know that in some of the earliest surges of the pandemic, nurses were experiencing some pretty high levels of symptoms of things like PTSD, fatigue, and burnout. And so this is a very concerning and risky time for nurses. We also know, however, that these are not new issues to nursing. And a lot of the research that my team has been working on in the last couple of years actually deals with data that took place or that we have access to from prior to the pandemic. And we have been able to show that even prior to the pandemic, among nurses who died by suicide, there were really high levels of job issues, anxiety, depression, and physical health problems. There are some good studies coming out right now related to pandemic-specific problems. And I just want people to remember that these are pandemic-specific issues that are overlaid on top of the profession-wide problem that was really looming well before COVID ever came to the United States. Our study team actually has been looking at the data from the National Violent Death Reporting Statistics database, which the CDC compiles. And we have data from 2003 to 2019. So again, pre-pandemic data. And what our team has done in the last couple of years is go back to those data and really try to understand, do deeper dives into some of the antecedent variables, which are all, also collected in that database, and really trying to look at, what are some of the mental health issues, substance use issues, kind of other contributing factors that may or may not have been reported, and are there differences between the nurses and the general population? And so our first study was a comparative analysis using quantitative data. And what we found is that nurses were significantly more likely to have mental health issues, and specifically depression, reported prior to death by suicide. They were also significantly more likely to have job problems, and female nurses were more likely to have physical health problems reported prior to death. Interestingly, for people for whom substances were implicated as contributing to the cause of death, nurses were more likely to be positive on their toxicology results across all substance use classifications. But, and this is a really important but, there were no known differences in substance use history between the nurses and the general population, which might make you wonder, like, okay, so nurses are all of a sudden at the time of death more likely to use a bunch of substances, which is different than the general population that have no preceding history of substance use. And so, of course, our wonder, or our question is this a result of underreporting, which seems to be supported by some of what we understand about nurses from other studies. For the nurses for whom job loss was indicated as one of the primary kind of contributing factors to death, which is about 200 nurses, substance use, depression, and the investigation around substance use was present in the majority of nurses who died by suicide. So again, this is a small group, it's very difficult to make kind of broad inferences, but we know that for at least that group of nurses, there was something about investigation into their own substance use, or the combination of job loss and substance use issues and, mental health issues, specifically depression, that seem to contribute to their death by suicide. And so we're really now trying to better understand what is happening in that specific moment. What is it about the investigation into substance use and sort of going into disciplinary procedures that is making nurses very vulnerable to death by suicide? And I think that's an inflection point. That's actually something that we, as nurse leaders and kind of as leaders in the health profession, can actively do something about very quickly. The first and most basic lesson that I think we need to learn and sort of take ownership of is that mental health and substance use issues are treatable and common problems that can occur in any human being, and should be treated just like any other comorbid condition or lifelong chronic condition. And so we've got to really own that and understand that and treat our nurses using that kind of empathetic framework. And within the nursing profession and within healthcare in general, we have a culture that normalizes moderate to heavy use of substances as legitimate coping mechanisms. And then the moment that a nurse actually shows up with a diagnosable substance use problem, they're immediately isolated and alienated from the same social sphere that just a week prior seemed to be promoting kind of behaviors that might lead to addiction. Because of the complex relationship between work stress, burnout, mental health, and substance use, I think it's really important that we understand that our work environments are likely contributing to maladaptive coping mechanisms. And because we're leaders in these work environments, it is our duty and our kind of obligation to then help provide for resources to promote adaptive or healthy coping mechanisms, or to help those who find themselves in trouble with maladaptive coping mechanisms. This is not a situation where it is, in my opinion, okay for healthcare institutions to take a hands-off approach and lay the entire responsibility at the foot of the individual nurse, because I truly believe that our environments are contributing to some of these outcomes. I also finally really would love for nurse leaders to understand and take to heart what we know, which is that nurses who are made to feel isolated or weak because they're asking for help are potentially at increased risk for death by suicide. So I really want people to understand that the stakes are high, and that we really have an opportunity and an obligation to ensure that our culture affirms help-seeking behavior.